Hello friends, let's today talk about the reasons for slip disc. Slip disc, which is also known as disc prolapse or disc herniation or lumbar PIVD or also known as PLID, all these spectrum of diseases, they represent one common terminology known as slip disc. It normally happens in the lower part of the spine known as the lumbar spine. Now, before we start on the causes of slip disc, let's first understand what is a disc. Disc is basically a shock absorber between the bones of the lower spine. So between two bones, there is a soft cushion-like structure filled with jelly. It is known as disc. The role of disc is to take the stress. Basically, whenever you are jumping or sitting for a long time, the loading part is taken care by this disc. Consider it as a tire in your car. It is like a tire. It has one outer covering known as annulus fibrosus and inner jelly filled part which is known as nucleus pulposus. Now, what causes slip disc? There are basically 6 reasons for slip disc. First is the age-related degeneration. Basically, the normal aging process weakens this outer layer, annulus fibrosus of the disc, and with time when it weakens, there is a chance that due to some sudden movement or some activity, it might ultimately give away. Even if there is no sudden activity, over a period of time, small cracks develop in this annulus fibrosus layer and it weakens it. So age-related degeneration is one of the most common causes for slip disc. Second is repeated bending or repeated heavy lifting. Like if you are working out in a gym regularly, you are lifting heavy weight, or if you are lifting weight while bending down, that can badly affect your disc. Normally what happens if you are bending forward like lifting a suitcase and suddenly there is a catch in the bag, it represents that there is a slip disc problem in your back. Normally, if the posture is not good or if the technique is not right and you try to lift heavy weight, or you are working in a shop where you have to bend down repeatedly to lift up the heavy material, then that can also lead to slip disc. Third most common reason is sudden twisting injury or a fall. If you are a cricket player or a rugby player and if there is a sudden twisting injury to your spine, then also there are high chances that you might injure your disc in the spine. Or if you are falling down from height, say if you slip from the first floor or the second floor of a building and you land on the ground, then also there are chances that the disc might rupture. Fourth is sedentary lifestyle or poor posture. Supposing if you are not exercising, if you have a job which wants you to sit for prolonged hours in the office, in those situations also you are more prone to develop slip disc problem in your spine. If your posture is not good while working, supposing if you are sitting on a sofa or sitting on a bed and working on your laptop for long hours, that is not good. If your posture is not good, that can also lead to disc related problems in the spine. Also, whenever you are sitting, you should always use a proper office chair and table for working so that ergonomically also your posture is good and you do not develop slip disc in future. Fifth reason for disc herniation is obesity. If somebody is overweight, his or her weight is more, that puts a lot of pressure on the spine, and that pressure is transferred to the disc of your spine in the form of load. So over a period of time, the disc of your spine becomes loose or weak, and the outer fibers of the disc known as annulus fibrosus, they give away. And when that happens, the nucleus part comes out and it starts pressing the nerve, which can lead to sciatica also. So control your body weight, that is very important. Sixth reason for slip disc or disc herniation is genetic reasons. Sometimes it runs in the family, that if father or mother is having discs which are smaller in size, the outer layer of the annulus is not thick enough, then that can also lead to early disc degeneration or disc prolapse in young patients. So friends, there are overall 6 reasons. First is age related, which you of course cannot change. Next is repeated stress or bending or weightlifting. This of course is modifiable. So you need to be very careful when you are lifting weight or if you are doing repeated bending movements. Third is sudden twisting injury or fall. So you should be very careful while playing that you should not injure your back, especially while playing or during the exertional activities. Fourth is sedentary lifestyle or poor posture. So whenever you are working on your laptop or you are in your office, your posture should always be good and you should use a proper office table and chair. Fifth is overweight and obesity. So you should try to reduce your weight, keep it at a healthy level. You should not eat fried food or try to eat something or try to have junk food daily so that your weight is under control. And sixth is genetic predisposition. So genetic predisposition, of course, you cannot change. So it is a non-modifiable risk factor. But overall, if you will keep your weight under the limits, you will regularly exercise, keep your posture good and avoid any sudden bending or twisting movement, you can keep your spine safe and you can prevent slip disc problem in future. Thank you.